So now we're going to do a technique evaluation and treatment sequence of the whole area of the upper chest wall, the sternum, what some people might call the thoracic outlet region. I think this work is so much more than just working the thoracic outlet that I hate to even call it that. I'm going to be putting or asking to put my hands on my patient's sternal region, and I think that needs clear instructions, clear permission, clear boundaries with the patient. Here's what I want to do. Here's why I want to do it. Are you okay with that? If at any point she seems a little uncertain, or it feels I'm thinking that she's not liking what I want to do, well, I'll sit her up, we'll have a conversation about it. But Melissa, we talked about this before. What I'd like to do is put a hand right on your sternal region, right in the middle of your chest like that. I'm going to be putting some pressure down toward the table and lightly down toward your feet. That's the start of the technique. At another time, then I'm going to be adding a second hand into this part of your neck and stretching in that direction. We're looking to connect with some of those swallowing issues that you described to me, some of that feeling in this whole upper chest that you described to me earlier. Are you okay if we do that?
Yes.
Okay, good. So I'm going to get myself in position here, and where I'm putting my hand is the heel of the hand should be just at or below the sternal notch. I don't want my hand up too high, putting pressure on the anterior neck region. I want to come down so my hand is on the sternal region. I'm going to encourage you to, with permission, let your hand drop onto the sternum, because if you do the technique with just the heel of your hand in contact with the upper sternum, kind of like a wheelie here, it can be pretty uncomfortable for the patient. I'm going to have my hand relaxed, but in my fingers together, but not tensing together. You should be relaxed, they should be relaxed. I start the sequence where I head down toward the table and down toward the feet. It's kind of we're heading in that direction. There's times when I may actually stand up and give her a little bit more pressure, but typically I keep my pressures very light to light moderate. I'm looking side to side, I'm comparing and contrasting, and I'm feeling an interesting area right here on your right upper sternal region. You feeling something there?
Mm-hmm.
Feel it? Yeah. Again, we're looking for relevance, Melissa. This is hypothetical, but that's the type of thing I'm looking for. I'm looking to connect with something that I feel, but that you validate for me. So we could spend a lot of time working just with that single hand right in here. I could vary it from more of a pressure in through the intercostal region, into the chest wall, or we could make it more about a skin stretch, heading down toward her feet. And as soon as I do that, you can see the tension that's created on the skin and everything that's below the skin, including nerves, including the muscle, the fascia, all the stuff that's there. But I'm looking not to care about what tissues I'm affecting. I'm looking to connect with relevance in Melissa. So we could spend time there. At some point, I'm going to put a hand on the middle part of her neck. My hand is cupped like that. My pressure is on my finger pads in the heel of my hand with very little pressure on the middle of my hand. So I'm not putting a lot of pressure directly in midline on her. I'm going to slide here for just a moment to show you the direction that I would have you do with your hands, and that's this sort of a movement. It's a scooping action, okay? What I don't want to feel is that I'm simply tipping her head back or jamming her jaw closed. I'm going to sort of sneak by it, but it's sort of incidental contact versus forcing her head back. But I would engage, I compare side to side, I lightly engage her skin in a stretch in that direction like that, and there's something over there that interests me on my index finger that you can't see from the camera, but I'd be having a conversation the entire time because she's the important aspect of this work. What she's feeling is probably the most relevant aspect of my work, and if it's not feeling like it's familiar or helpful or useful, then I'm not going to keep doing it.